Now we're scanning the right upper abdomen as the female has pain in the right upper abdomen after gallbladder surgery or removal. The liver shows normal texture, no intrahepatic biliary channels dilated. Now we will scanning the gallbladder fossa. Here we see a calcified area or echogenic area in the gallbladder fossa. Here we see the shadow of this calcified area. This could be a stone or remnant of gallbladders. Now we will examine the common bile duct. Here we see the portal vein, which is normal, not dilated. This is common bile duct, which also shows normal diameter and not dilated. Now how we will write report.